Welcome to the deep dive. Today we're going to be looking into the world of cystic thyroid nodules.
Okay.
You might be here because you've had one, know someone who has, or just, you're just curious about these fluid-filled lumps that show up in the thyroid gland.
Yeah, and even though that term nodule might sound a little scary,
Right.
it's important to remember that most of the time, cystic thyroid nodules are benign.
Oh, okay.
But there's always a chance that they could be, malignant,
Right.
meaning cancerous. And that's why it's important to understand them, how they're found, diagnosed, and treated.
Absolutely. Yeah, that's
Yeah.
what we're here to do. So how are these nodules typically discovered?
Well, a lot of times people are surprised to find out that a lot of cystic nodules are actually found by accident.
All right.
Maybe during a routine checkup
Okay.
or even imaging for something else completely unrelated.
So they're kind of sneaky, huh?
Yeah, they can be. Not always a dramatic presentation.
But I imagine they don't always stay quiet, do they?
No, you're right. Sometimes they definitely make their presence known.
Okay.
You can have symptoms like neck pain
Right.
or maybe even trouble swallowing.
Uh,
And in some cases, you can have sudden bleeding into the nodule, which causes a painful, noticeable lump.
oh, wow.
And even more rarely, you might even have temporary hyperthyroidism,
Mm.
which is where the thyroid gland makes too much thyroid hormone.
So it's not just the nodule itself, but, what's going on inside it that matters.
Right.
Can you tell us more about what these cysts are actually made of?
Sure. So most of the time when we're talking about cystic thyroid nodules, they're what we call benign adenomas,
Okay.
which is basically it's just a collection of normal thyroid cells that have kind of grown a bit out of control.
Okay.
But like we talked about before, cancer can also show up as a cystic nodule, so it's really important to get an accurate diagnosis.
Right. So that brings up the question of how doctors tell the difference between, a benign adenoma and like a potentially cancerous nodule. What are they looking for?
So purely cystic nodules, the ones that are completely filled with fluid, those are rarely cancerous.
Okay.
But if it's got both fluid-filled areas and solid components, what we call a complex nodule,
Okay.
that needs a closer look. Statistically, the chance of cancer in those complex nodules is about 5 to 10%, which is pretty much the same risk as solid nodules.
Okay.
And the kind of cancer that's most often associated with cysts is papillary thyroid cancer.
So we've got these nodules, some purely cystic, some complex. What's the next step? How do doctors figure out what's really going on?
Well, it kind of works like solving a medical mystery.
Okay.
The first thing they'll do is order a blood test
Okay.
to check your TSH levels.
Right.
And TSH, or thyroid-stimulating hormone, is produced by the pituitary gland, and it basically tells your thyroid how much hormone to make.
So those TSH levels can give some clues about what's up with the nodule.
Exactly. Usually TSH levels are normal, but, if the nodule is making too much thyroid hormone, then the TSH levels could be low.
Okay, so what else besides blood tests do they do to look at these nodules?
The next thing they'll do is an ultrasound,
Hmm.
which lets the doctors actually see the nodule
Okay.
and identify any features that might,
Okay.
suggest cancer.
Mm-hmm.
So, for example, if they see irregular borders or what we call microcalcifications, that can be a red flag.
Right.
And then finally, there's fine needle aspiration, or FNA.
The FNA.
Yeah.
I imagine it's not the most, comfortable procedure.
It's a really important step in diagnosis,
Right.
but it's not as bad as it sounds. Basically, they use a very thin needle to get a sample of cells from the nodule, and then they look at those under a microscope.
Mm.
And it's really important to use ultrasound guidance, especially for those mostly cystic nodules, to make sure they get a good sample. And sometimes they might even have to repeat the FNA just to be sure.
So after all that testing, what happens next? How do they actually, manage these nodules, especially if they turn out to be benign?
So the treatment really depends on what the FNA shows.
Okay.
If the cyst is benign, there are a few things they might do.
Okay.
Aspiration, where they use a needle to drain the fluid from the cyst, is often the first step.
So in some cases, it's just like drain it and it's done.
Right, sometimes that's all it takes.
And what happens when a cyst, decides to come back?
Well, that's the thing. Recurrence after aspiration is pretty common.
Okay.
And that might mean they have to do the procedure again.
Okay.
And if it keeps coming back, or it starts causing problems,
Right.
then they might recommend surgery to take it out completely.
Okay.
Now, I know we talked about ethanol injections earlier.
Right. You mentioned that. What's that about?
Yeah, so ethanol ablation, where they actually inject alcohol into the cyst,
Okay.
it's a way to shrink it and hopefully stop it from coming back, and it's an alternative to surgery.
Ethanol.
Mm.
That seems pretty straightforward. Is that a common thing?
It's more common in Europe and Japan, but it's gaining popularity around the world as a less invasive option for treating benign cystic nodules.
Interesting. So we've talked about what happens when it's clearly benign.
Yeah.
But what about those cases where the FNA is kind of inconclusive? What do they do then?
That's a really good question. It's almost like you get to a fork in the road and you're not sure which way to go.
Right.
Those inconclusive cases, well, they can be a little tricky.
Yeah.
It's like having a missing piece of the puzzle.
So what happens then? Is it just like a waiting game?
Sometimes, yeah, but it's not just sitting around and doing nothing.
Okay.
A lot of times they'll need to do another FNA, especially if there's a solid component to the nodule.
Right, because those solid parts are the ones that are concerning.
Exactly.
Another biopsy. I can see why some people might not be thrilled about that.
Mm-hmm.
Are there any other options in those situations?
Yeah, there's another thing called ultrasound monitoring. They basically use ultrasound to keep an eye on the nodule and watch for any changes in size or how it looks over time.
So they're basically just watching it closely to see if anything changes.
Right. If there are any big changes, they might need to look into it further. And of course, sometimes they might even recommend surgery even if the FNA results aren't clear.
When would they recommend surgery, even with, uncertain results?
Well, if the nodule has a large, solid component or it looks suspicious on the ultrasound, surgery might be the safest option. It's always about weighing the risks and benefits for each patient individually.
That makes sense. It seems like dealing with thyroid nodules is a very, careful process.
It is, yeah. And there's another concept I think is important to understand what a cold nodule is.
Cold nodule.
Yeah.
That sounds kind of ominous. Is that something to be worried about?
Well, cold in this context doesn't necessarily mean it's bad. It's a term used in thyroid scintigraphy, which is another type of imaging that can help evaluate the thyroid.
Okay, so how does thyroid scintigraphy work? And what's the deal with these cold nodules?
Okay, so in a thyroid scintigraphy scan, they give you a small dose of radioactive iodine or technetium. It's perfectly safe.
Okay.
And this gets absorbed by the thyroid gland. Then they use a special camera to take pictures of your thyroid, which shows how that radioactive material is distributed. So nodules that don't absorb much of the radioactive material show up as these cold spots.
So what makes these cold nodules important in the diagnostic process?
Well, they can be an important clue, especially when you consider them along with the other findings.
Okay.
They can sometimes indicate that there's a problem, particularly if the TSH levels are also low. But keep in mind, cystic nodules, especially those filled with just fluid, they often appear cold on these scans just because they're not made of active thyroid tissue. They're not producing thyroid hormone.
Right.
But in some cases, a cold nodule could be a non-functioning adenoma or, less commonly, cancer.
So cold nodules aren't necessarily a reason to panic, but they do need to be checked out.
Exactly. It's just another piece of the puzzle along with the other tests we talked about. The goal is to really understand what's happening with each individual nodule and figure out the best way to manage it.
This has been incredibly informative. We've covered a lot, from how they're discovered to how they're diagnosed to the different treatment options. It's clear that these nodules are complex and they need a careful approach.
Absolutely. And I think we've busted some myths along the way, too, like the idea that all cold nodules are bad news. It's really about looking at the whole picture and working with your doctor to make the best decisions for your health.
Well said. You've been a fantastic guide through this complex topic. Before we wrap things up, is there anything else our listeners should know, something to leave them thinking about?
You know, one thing I think is really fascinating is that the field of thyroid nodule treatment is constantly changing. We've come a long way from just relying on surgery to remove them. Who knows what amazing treatments we'll have in the future?
That's an exciting thought. Imagine minimally invasive procedures or even targeted medications to treat these nodules. Definitely something to look forward to.
Speaking of looking forward, there's another type of cyst I think is worth talking about. Thyroglossal duct cysts.
Thyroglossal duct cysts. That sounds pretty mystical. Tell me more.
They do have a kind of interesting origin. You see, when a fetus is developing, the thyroid gland actually starts near the base of the tongue, and then it migrates down to its final spot in the neck.
It makes quite a journey.
It does, but sometimes things don't go perfectly to plan.
Right.
And a little bit of that pathway, called the thyroglossal duct, stays behind.
Okay.
And that can form a cyst. Most of these cysts show up during childhood or adolescence, but sometimes they pop up in adulthood too.
So it's like finding a forgotten treasure years later. Except, maybe a little more surprising, are these thyroglossal duct cysts always benign?
Thankfully, most of them are, but there's always a small chance they could become malignant, which is why doctors usually recommend removing them, especially if they start causing problems.
Better to be safe than sorry. You also mentioned earlier that some other types of cysts can be mistaken for thyroid cysts. Can you remind us about those?
Sure, so there are parathyroid cysts, which are pretty rare,
Okay.
but you can tell them apart because they have high levels of parathyroid hormone in the fluid.
Okay.
And then there are cystic hygromas, which usually show up in childhood.
Hmm.
And unlike thyroid cysts, they don't move when you swallow.
Okay, got it. Any others we should be aware of?
One more, branchial cleft cysts, which come from leftover tissue from when we were embryos.
Yeah.
They're usually found in the upper neck off to the side. And they also don't move when you swallow, which helps tell them apart from thyroid cysts.
Wow, our necks are more complicated than I realized. But it's good to know that doctors can tell the difference between all these different types of cysts and recommend the best treatment for each one.
Absolutely, and I think that's a key takeaway from today. Knowledge is power.
Mm-hmm.
The more you know about cystic thyroid nodules and other related conditions,
Right.
the better equipped you are to ask the right questions, make informed decisions, and work with your doctor to get the best possible outcome for your health.
Well said. A huge thank you to our expert for guiding us through this fascinating and maybe now a little less mysterious world of cystic thyroid nodules and other neck cysts.
My pleasure.
And to our listeners, thanks for joining us on another deep dive. We hope you found this exploration insightful and empowering. Until next time, keep those questions coming and stay curious.
Yeah, and those inconclusive cases, they can be kind of a head scratcher.
Right.
Like you're missing a piece of the puzzle.
So what happens then? Do you just wait and see?
Well, sometimes, yeah, but it's not just a passive wait and see kind of thing.
Okay.
A lot of times they'll need to do another FNA, especially if the nodule has a solid component.
Right, because those solid parts are the ones that are more concerning. So another biopsy, I could see how some people might not be too happy about that. Are there other options, though, in those situations?
Yeah, there's something called ultrasound monitoring.
Okay.
And basically, they use ultrasound to keep an eye on the nodule and look for any changes, in its size or how it looks over time.
So they're just watching it carefully to see if anything changes?
Exactly. And if there are any significant changes, well, that might mean they need to investigate further. And of course, sometimes they might even recommend surgery, even if the FNA results are inconclusive.
When would they recommend surgery even with those uncertain results?
Well, if the nodule has a large, solid component, or if it has other features on ultrasound that look concerning, then surgery might be the safest option. It's always a balancing act, weighing the risks and benefits for each individual patient.
That makes sense. It seems like navigating the world of thyroid nodules requires a lot of careful consideration and decision-making.
It definitely does. And there's another concept I think is important to touch on, understanding what a cold nodule is.
Cold nodule. It sounds a little ominous. Is that something to be worried about?
Well, cold in this case doesn't necessarily mean that it's bad. It's a term that's used in thyroid scintigraphy, which is another imaging technique that can be helpful in evaluating the thyroid.
Okay, that's interesting. Can you explain a little bit more about how thyroid scintigraphy works and what these cold nodules mean?
Sure. So in a thyroid scintigraphy scan, they give you a small dose of radioactive iodine or technetium.
Okay.
It's perfectly safe.
Okay.
And this gets absorbed by your thyroid gland. And then they use a special camera to capture images of your thyroid, which shows how this radioactive material is distributed. So nodules that don't absorb much of that radioactive material, well, they show up as these cold spots on the images.
I see. So what makes these cold nodules significant in the whole diagnostic process?
Well, they can be an important piece of the puzzle, especially when you consider them along with other findings. Cold nodules can sometimes indicate that there's an issue, particularly if the TSH levels are also low. But it's important to keep in mind that cystic nodules, especially those that are completely filled with fluid, they often appear cold on these scans just because they're not made of active thyroid tissue. They're not producing thyroid hormone.
Right.
But in some cases, a cold nodule could be a non-functioning adenoma or, less commonly, even cancer.
So cold nodules aren't necessarily a cause for alarm, but they do warrant attention and further investigation.
Exactly. They provide another piece of the puzzle along with those other tests we've talked about. The ultimate goal is to really get a comprehensive understanding of what's happening with each individual nodule and determine the most appropriate course of action.
This has been incredibly informative. We've covered a lot, from how cystic thyroid nodules are discovered to the diagnostic process and even the various treatment options. It's clear that these nodules are complex and require a very nuanced approach.
Yeah, and we've debunked some common misconceptions along the way, like the idea that all cold nodules are something to worry about. It's all about looking at the bigger picture and working with your doctor to make informed decisions about your health.
Absolutely.
Yeah.
You've been a fantastic guide through this intricate topic. Before we wrap things up, is there anything else you think our listeners should keep in mind? Maybe a final thought to leave them pondering.
You know, one more intriguing aspect I'd like to highlight is that the field of thyroid nodule treatment is constantly evolving.
Mm,
We've come a long way from solely relying on surgical removal. With ongoing advancements in technology, who knows what innovative treatments might emerge in the future.
that's exciting. Imagine a world where these nodules could be treated with minimally invasive procedures or even targeted medications. Definitely something to look forward to.
And speaking of looking forward, there's another type of cyst I think is worth discussing, thyroglossal duct cysts.
Thyroglossal duct cysts. They sound almost mythical. Tell me more.
Well, they do have a kind of intriguing origin. You see, the thyroid gland actually begins its development in a fetus near the base of the tongue,
Hmm,
and then it migrates down to its final location in the neck.
that's quite a journey.
It is, but sometimes things don't always go according to plan.
Right.
And a small remnant of that pathway called the thyroglossal duct remains behind and forms a cyst. Most of these cysts actually manifest during childhood or adolescence, but occasionally they can appear in adulthood as well.
So they're like those forgotten treasures you stumble upon years later, except maybe a bit more surprising.
Are these thyroglossal duct cysts always benign?
The vast majority of them are, thankfully, commissionate. However, there's always a slight chance that they could turn malignant, which is why doctors usually recommend removing them, especially if they start causing problems. Better to err on the side of caution, it seems. And while we're on the topic of other types of cysts, you mentioned earlier that some can be mistaken for thyroid cysts. Can you remind us about those?
Certainly. So you have parathyroid cysts, which are relatively rare, but they can be distinguished by the presence of high levels of parathyroid hormone in the fluid. And then there are cystic hygromas, which typically present in childhood. And unlike thyroid cysts, they don't move when you swallow.
Got it. Any others we should be aware of?
One more, branchial cleft cysts, which develop from leftover tissue from embryonic development, are usually located in the upper neck off to the side. They also don't move with swallowing, which helps differentiate them from thyroid cysts.
Wow. Seems like our necks are a lot busier than we realize. But it's reassuring to know that doctors have ways to distinguish between all these different types of cysts and recommend the best course of action for each one.
Absolutely. And I think that's a key takeaway from our deep dive today. Knowledge is power.
Mm-hmm.
The more you understand about cystic thyroid nodules and other related conditions, the more empowered you are to ask the right questions, make informed decisions, and work collaboratively with your healthcare provider to ensure the best possible outcome for your health.
Well said. A huge thank you to our expert for guiding us through this fascinating and, dare I say, slightly less mysterious world of cystic thyroid nodules and other neck cysts.
It's been my pleasure.
Yeah, it is reassuring to know that even with all these different kinds of cysts, doctors can figure out what they are and what to do about them.
Right.
But let's get back to the cystic thyroid nodules for a minute. It sounds like treatment options have come a long way. But I'm curious to hear more about this ethanol ablation procedure. Could you tell us a bit more about how that actually works compared to surgery?
Sure. So ethanol ablation, it's also sometimes called percutaneous ethanol injection, or PEI. It's basically a technique that's used to treat benign cystic thyroid nodules. And what they do is they inject a high concentration of ethanol directly into the cyst.
Okay.
And they do this under ultrasound guidance so they can see where they're going. And that ethanol basically causes the cells that line the cyst to die, which makes the cyst shrink and hopefully prevents it from coming back.
So it's basically like destroying the cells that are making the cyst. How does that compare to actually surgically removing it?
Well, surgery is often very effective at getting rid of the whole cyst and preventing recurrence.
Right.
But it is more invasive. It requires general anesthesia, an incision in the neck, and it takes longer to recover from ethanol. Ablation, on the other hand, can be done with just local anesthesia.
Yeah.
It only needs a small needle puncture, no incision, and patients can usually go back to their normal activities pretty quickly.
So it sounds like ethanol ablation is a less invasive option with potentially a faster recovery. That definitely sounds appealing. Are there any downsides to it? Or risks? Yeah. Compared to surgery, I mean.
That's a good question. While ethanol ablation is generally considered safe and well tolerated, there are some potential risks and drawbacks to keep in mind. Like any procedure, there's always a chance of things like bleeding infection or pain at the injection site.
Right.
Some patients might have some temporary voice changes or discomfort swallowing after the procedure. And while it does have a high success rate, it's not perfect. Some cysts might need multiple treatments or they could eventually come back.
So it's not a guaranteed fix, but it seems like it offers a really good alternative to surgery in a lot of cases.
Mm.
It's interesting to think about the pros and cons of each approach.
Exactly. And that's why it's so important to have a good conversation with your doctor to figure out which treatment is best for you. Every patient is different.
That's a good point. It really highlights how important it is to be informed and to have open communication with your healthcare provider.
Couldn't agree more. And I think that's a key takeaway from our deep dive today. We've covered a lot of ground, from the different types of thyroid nodules and cysts to how they're diagnosed and the treatments that are available.
Right.
But at the end of the day, the most important thing is to be an active participant in your own health journey.
Absolutely well said. Knowledge empowers us to ask the right questions, understand our options, and make choices that are right for us as individuals.
Exactly. Don't be afraid to ask questions. Seek out good information and advocate for yourself. You are your own best advocate.
Thank you so much for sharing your expertise with us today.
Right.
It's been a fascinating journey, and I feel much more equipped to navigate this complex world of cystic thyroid nodules and other neck cysts.
It's been my pleasure.
And to all our listeners out there, thank you for joining us on another deep dive. We hope this exploration has been insightful and empowering. Until next time, keep those questions coming and stay curious.